heart and vascular system. I am responsible to teach to you. Dr. Pasbaksh, in the 8th to 10th class with you, yes? What was your title?
Terminal.
Oh, terminal. That's good. A little fast, we are going to start the remain of the bones. I know that this class it is very difficult for you because 8 to 10 at the first you read the terminology, and just now I'm going to teach to you the bones of the that participate in the thorax. It is a little difficult, but I try to repeat to become easy for you to understand. Your reference will be the grade anatomy for the students, you know, the grade anatomy for the students. About the thorax, you should prepare your reference will be the grade anatomy or snare anatomy, not both of them, one of them. Grade for a student or snare, it's up to you. You are easy and friendly with each of them because both of them are the same, but you should know the main and the important title I am going to speak and explain for you in the class. But some titles that are easy for you to study, no, because of limitation of the time. We don't have enough time to explain about everything. So about the main structure, about the main title, about the important title, I'm going to speak and explain for you in the class. After some theory class, you are going to have the practical. But at the first, we should study and we should teach to you the theory. In this picture, if you notice, you are able to find the thorax. In the thorax, we have some bones. It is possible you'll be familiar with some of these bones, such as the sternum,
Ribs.
such as the ribs, and the vertebral column. But about the vertebral column is a column that it is going to begin at the base of the skull, and it is going to be continuing the neck, in the thorax, in the abdomen, and in the pelvis. In this picture, you are going to look at some of these vertebral bones that are visible in the thoracic region and in the lumbar region. About the neck or cervical region, they are not visible in this picture. So, about the vertebral column, you should know at the first we have in the embryonic time. In embryonic time, at the first we have 7 cervical vertebrae. How many vertebrae, how many bones are going to participate in cervical region? 7. We call cervical vertebra. This C is going to be a landmark from C1 to C7. So in radiography, it is possible in your office, when you are in the office, the patient brings for you a report from a radiology, and write for you, for example, we have herniation between C5 and C6. You know that C5 and C6 are going to be found in the cervical region, not superiorly. No, it is inferior, between C5 and C6, or between C3 and C4. So we have 7 cervical vertebrae to be able to explain. We use from C1 to C7. In continue, after the cervical region, we are going toward the thorax, to the chest. So we have 12 thoracic. We have 12 thoracic vertebrae. This tip is going to help explain to us. We are going to show you T1 to T12. It is possible after a trauma, you have problem, you have a broken vertebra, for example T11 or T7. You know, we are going to speak about the thoracic vertebra, not about the cervical, not about the lower part of the vertebral column. Do you get that? Now, after the cervical region, thoracic region, we are going to the abdomen. We are going inferiorly. So we call lumbar vertebra. How many vertebra are going to be found in lumbar vertebra? 5. 5 lumbar vertebra in human. To be show the lumbar vertebra, we use L1 to L5. In continue, we are going to the pelvic region. In pelvic region, we have sacral. Sacral vertebra at the first consists of 5 single and separate vertebra that we call sacral or sacral. We use from the term of the S and show you S1 to S5. In continue, at the end of the vertebral column, we call coccygeal vertebra. We call coccygeal vertebra. Normally, commonly, we have 4 coccygeal vertebra that we can use CO, for example, to C4, coccygeal. It is in the embryonic period when the baby is going to develop in the uterus, okay? But during the development, something happened. The 5 separate single bone of the sacral region fuse to each other, attach to each other, and reduce to 1. In adult, we have a triangle bone that we call sacrum. Yes, at the first, this sacrum consists of 5 single, but these 5 single, 5 separate, fuse to each other, join to each other to be able to become one and large and triangle bone. Here, normally we have 4 coccygeal bone. In developing time, these 4 join to each other and make 1 coccygeal bone. So here -4, here -3. At the first we have 33, but with this minus at the end we have 26. What happened that 33 become 26? You know, 4 vertebra minus here and 3 here, so the 33 become 26. In adult, in normal adult, we have 26 vertebra that they are going to make the vertebral column for us. This vertebral column is going to be start to begin at the base of the skull, and in the midline it is coming down and to be continued to the pelvic region. You know, inside of the vertebral column, the spinal cord is going to be fine. We can imagine that the skull is going to support to protect the brain. The vertebral column is going to support to protect from the spinal cord. The thorax is going to protect to support from some of the main organs inside of the thorax, such as the lungs, such as the heart, such as the great vessel. Do you get that? Do you have any question? Now, here, at the first, in uterine time, in uterine period, at the first, when a baby is going to be formed, you have one cell. This cell is going to divide and make two cells, four cells, okay? And at the end, we have structures such as this. And it is the cranial and here's the caudal. And they are going to develop, for example, the heart, the brain, everything is going to develop and become a baby, okay? Now, during this development, about the vertebral column, something happened. What happened? At the first, we have 5 separate bones in the sacral region, 4 separate bones in the coccygeal region. With the developing, something happened. These 5 joined to each other. These 4 fused to each other, become radius to 1. Radius to 1. Okay? So here 7, 12, 5, 1, 1 become 26. But at the first, we have 7, 12, 5, 5,